good morning, good afternoon, and good evening, everyone watching around the world. I'm happy to be with you here today, and I hope you are all safe. Our lecture today, it's a very interesting topic. It's about the future of dentistry from the digital era to the smart era. As we all know, the word digital is always associated with a computer. If you have anything, you have to use it on the computer, then it's digital or digitized. So digital is associated with computer or computer generated. Few years ago, a digital dentistry revolution happened. This is because of the advancement in the biomechanical engineering of materials, advances in computer hardware, as well as software. And this led to the digital dentistry revolution. So what are the components of digital dentistry? This is not my topic today, but this is just an intro to be acquainted with what is digital dentistry. We have the digital acquisition, starting from DSL cameras, cone beam CTs, scanners, whether intraoral or lab scanners, facial scanners, of course, which is a very hot topic nowadays. So these are the main acquisition or diagnostic parts of the digital dentistry. We have the next step in digital dentistry, what we call the digital planning, using a software where we combine all these modalities together using a registration, and we can start our planning. And the final step in digital dentistry is digital manufacturing, either by milling using a CAD/CAM device, or by printing layer by layer, or building up layers using the 3D printer. So this is an intro about digital dentistry, and of course, digital dentistry is not complete without digital practice management software and, of course, digital marketing. And the question here, is digital dentistry now, is it the future? Of course not, it's reality. Digital dentistry now is a reality, it's not the future. Because I always see in promos, digital dentistry is the future. No, it's not the future, it's a reality. The full digital workflow, of course, is not common among all of us, but for sure, you have 1 step, 2 steps, or 3 steps during your regular workflow that involves digital dentistry. So let's start our lecture about the future of dentistry, the shift from the digital era to the smart era. So, is the smart era a reality or science fiction? Is it science fiction? Is this just from our dreams? No. So let's see what can be reality in the near future and what is science fiction. Years ago, maybe centuries ago, if you have the ancient Egyptians here and the ancient Romans here, and you tell them we are going to travel all the distance here, crossing the sea in just 4 hours at an altitude of 11,000 feet, nobody would have believed you. This is science fiction at that moment. But now this is a regular procedure every day. So you just take a plane and you can cross the sea from Egypt to Italy in just a matter of 4 hours or less. So science fiction is relative according to the time. So when we are going to talk about some advances that we can achieve, or maybe we can't at the moment, it's not science fiction most of the time. This is just the beginning of reality. So the smart era involves what we call artificial intelligence. Artificial intelligence is one of the most promising procedures in digital dentistry. And what is artificial dentistry? What is artificial intelligence? In simple words, artificial intelligence is a science of getting the machines or the computers or whatever to mimic the human behavior. So performing tasks that only human can perform. So artificial intelligence, in simple words, it's making computers or machines behave like humans. Then we have subdivision from artificial intelligence, what we call machine learning, is you feed the computer data and the computer can do simple tasks. Okay, and we have what we call the deep learning. Deep learning is similar to machine learning, but it involves making more or solve more complex problems. So we have artificial intelligence mimicking the human behavior. We have machine learning feeding data to get easy tasks, and deep learning also feeding data to get complex tasks. So how did artificial intelligence started? It started in the 1950s by using a simple test if a machine can trick a human. And the idea was coined 1955 by Joe McCarthy. And 1961, the first industrial robot. 1964, computers could do conversations with humans, and so on until 1966. After 1966, we had what we call a dead end and artificial intelligence winter. There was no more achievements, and artificial intelligence had stopped at this moment until 1997. Fast forward 30 years, when the Deep Blue intelligent IBM computer defeated Garry Kasparov, the chess world champion at the time. So this was a breakthrough at the time. And artificial intelligence started taking a steep curve to the top, beginning with the iRobot and the, of course, our mobile phones, the Siri, we all know in Apple phones, and more about Alexa, Amazon, and we have many applications nowadays, even if we cannot see them, but we use them every day. So what about machine learning? As we said, machine learning is a simple form of artificial intelligence that gets machines to make decisions based on feeding data. You give the computer data and ask the computer to do tasks. So this is machine learning. The difference between machine learning and deep learning is that machine learning is concerned about simple tasks, while deep learning is for complex tasks. A very simple form of machine learning is like when you type Google. If you type good, the computer will the Google will continue good morning. If you write Facebook, face shield, the computer chose those choices because of the relevance of search. It's about gathering the data that people write, and the computer can give you options that are more relevant to your search. What about applications of simple machine learning in dentistry? First of all, clinical decision support system. Your practice management software can help you taking serious decisions in your office. So there will be a next generation of practice management software that can give you, for example, financial advice. For example, I want to buy a CAD CAM or a laser. Which machine shall I buy? Which device shall I buy? The practice management software can do statistics for you and predict and calculate which machine is more efficient to you, which machine will get you more money, how many cases can you work with CAD CAM, and how many cases do you need a laser, which is convenient. And it can suggest the machine that you can buy. For example, I do, 10 laser cases for each month, and I do 300 CAD CAM restorations. The computer can calculate them and can give you a report. So these are based on the software from the dentist record. Also, it can book appointments with the patient according to their medical health condition. For example, if you have a diabetic patient, you will need to get more frequent follow-up visits than the regular patient. He is more susceptible to periodontal disease. For example, tobacco smoking patients, they will need more screening for cancer, and so on. The computer can help you book the appointments and direct you and save you a lot of time. What about deep learning? Deep learning, as we said, is a complex feature of machine learning. So when we're talking about deep learning, the computer gets some data, and it will require to solve complex. It will be required to solve complex problems. So, like what? For example, automatic caries detection. Many software nowadays are trying to use this feature by automatic detection of caries. So this can be done by feeding the computer lots of X-rays identifying the caries, and the computer can identify caries on its own in the future. So this is one feature. So it's all about giving the computer a large amount of data, and the computer can then compute it. Okay, so automatic caries detection. Another feature is automatic segmentation, that the computer can separate the piece based on its density, or of course with the help of artificial intelligence, as we can see. It's just an automatic process. You don't need to do a human intervention. The computer does it all. The software, the artificial intelligence, it segments the teeth. It can also draw the nerve. If you have, if some of you are using, for example, Blue Sky Bio software, it can draw the nerve on its own using artificial intelligence. We have, of course, the WebCeph software. Okay, it can do the cephalometric analysis in just 3 seconds with just one click. You just click, and afterwards you just need to fine adjust. Maybe not, but it's very useful. It saves a lot of time. Instead of putting 30 points for cephalometric analysis, you can just with one click have the points placed automatically. Also, automatic segmentation of teeth on the casts and identifying them. Like, for example, the Medit software now, with the recent update, it can segment the teeth automatic and identify them as well. It can number your teeth. Finish line drawing using artificial intelligence. We use it every day in ExoCAD, for example. You just click one point, and the software will identify the finish line. This is an option of artificial intelligence. Maybe we don't think about this, that this is artificial intelligence, but indeed, this is artificial intelligence, that the computer can identify the finish line on its own. In endodontics, for detecting the working length of vertical root fractures, if obvious, also in identifying periodontal disease. Also, another topic is the congestive computer and language processing. This feature allows our devices to respond to us with voice commands. It's like, or similar, the Siri or the Alexa in Google, or in Amazon, or in Apple phones. We can use this feature in our dental practice to save time and better infection control, as we can see here in this video.
Alexa, ask my helper to show the PA of number 7.
Showing the PA of tooth number
Just display.
7.
Alexa,
Just ask the computer
ask
to
my
display.
helper to compare the bite wings of number 19.
Comparing the bite with
Alexa, ask my helper to show all of number 24.
showing the images for tooth number 24.
Alexa, ask my helper to take a PA of number 9.
Capturing the PA of tooth number.
So, as we can see, it can save time. It's better for infection control, and it's a good marketing tool for the patient as well. Computer vision, or what we call automatic face recognition. Again, this is a feature available in our mobile phones, our smartphones. How can we use this in dentistry? We can use it in identifying the face and for detecting the best type of restoration. This can be available in the like DSD apps, like Neotech, like the DSD app. The computer, with just a 2D photo, can detect the facial features of the patient, and as well as the ethnicity and age. This is very beneficial. The computer then can suggest the suitable type of restoration or shape that we can place. This is the video from the DSD app.
DSD app's artificial intelligence generates a suggestive smile simulation. All you need to do is to take one frontal facial picture of your patient smiling. To create an AI smile, your first step is to position the smile frame onto the patient's existing teeth. To adjust the smile frame on the picture, use the arrows on your screen. To set the smile curve of your frame, move the horizontal white lines up or down. You will notice the ratio slider at the bottom of the screen. Move it to the left or right and it will set the proportions of the teeth. Tap Next. The AI identifies the average age of the patient based on the patient's facial structures and gives a suggested teeth shape and form based on the patient's facial features. But of course, you can select other shapes as desired by scrolling.
The computer detects the face of the patient, the age of the patient, male or female, and the computer can then suggest a restoration, and all you have to do is just adjust it or ask for another plan. It's easy. So it's very easy. So it saves us a lot of time. Again, another form of artificial intelligence in dentistry, our dental chairs one day can be able to detect our vital structures. If your mobile phone can detect your heartbeats, why not your dental chair? It can give you an alarm if you are sitting on a dental chair and the patient has a panic attack or a vasovagal attack, that the dental chair can warn you. This is a very good feature. Of course, maybe in the future, not available now or not still available now, but maybe it will become the regular dental chair in the future. But of course, artificial intelligence has pros and cons. So what are the advantages of artificial intelligence? Of course, accuracy in diagnosis, standardization, no effort and saves time. It's logical, feasible, easy, and standardized. But the problem with artificial intelligence is it's a complex mechanism, and you need a lot of data to import to the computer. You need to collect lots of data, enormous amount of data. And this is a very big problem for patient privacy. It's not easy to obtain those records. Data are complex and sensitive. Sometimes it's not accurate. For example, if you are doing an artificial intelligence cephalometric analysis for a mixed dentition patient, it will be, of course, more difficult than if you do it with a patient with a full permanent dentition. So sometimes it needs more accuracy. Another topic in the future of digital dentistry and the smart era is the robotic dentistry. And robotic dentistry is not a fiction, it's reality nowadays. So robotic dentistry, the idea, of course, started not from the dental field. It started with NASA, okay, space research, and then it was developed for other medical applications, then finally to the dental field. So the first robotic system for implant placement has been introduced to the market just 4 years ago in 2017. So it's available already in the market. And also in 2017, we had the first intelligent robot in China who could place implants on its own without any assistance from the dentist. The robot can detect the patient position and place the implant on its own, not assisted by any dentist. So hopefully our jobs will be easier in the future, but unfortunately, of course, it will be more expensive. The normal robotic surgery, we have a navigation system, a console, and a haptic device, and we have a plan. And we can do operations even remote. You can do your operation or surgery from another country. For of course, if you are in the USA, you can perform an operation or a surgery here in Egypt just with the haptic device and the controls that you have in the USA. So this is a breakthrough, of course. Another application of robotic surgery that is still in the progress, it's not yet available, is doing cavity preparations. And of course, this is implant, doing cavity preparations using micro robots and with connected to the computer with a console and an arm, an haptic arm. So you can just insert the micro robot with the camera in the patient's mouth, and you can do your cavity preparation while sitting on the on your dental chair or in your office chair, I mean. Of course, this is still not available, but this is in progress. This is what they are trying to do in the future. Nanotechnology and robotics can be used as a solution for attacking cancer cells. Artificial intelligence that can identify the cancer cells from the non-cancer cells and can attack the cancer cells only. So pros and cons for the robotic surgery: it's very accurate, you don't get fatigued, you have less error, it's minimally invasive, you don't need to open a big flap. You have all your robot doing that for you with highly accurate precision. But the problem is, first of all, it's very expensive. You have to buy the robot, and of course it will be very expensive. Sometimes also it's not accurate if you don't know how to use the haptic device. You need to know the surgery, then you need to know the haptic device. And about intelligent robot, it's not yet very common to use one. It's under research. But till then, we will control the robot with the haptic device. So you need to know the surgery, and you need to know how to control the haptic device to achieve the surgery. Also, it's a very steep learning curve. You still have to know the surgery, and you have to train on the haptic device, and you have to practice before doing a surgery like this. Another breakthrough in the smart era in digital dentistry is the 3D bioprinting, which means that you can print organs, living organs. So the idea started by the regular 3D printing by Dr. Charles Hull in 1984. He invented the 3D printing that we use nowadays in our office. Then in 1966 and in 2003, Dr. Thomas Bolland had the patency, and the first 3D bioprinter was introduced in 2009 in the market, of course. And we had many researchers talking about 3D bioprinting, about printing skin, kidneys, ear, tumors for research, of course. No, we're not going to print tumors for the patient. We are printing tumors to study them, ovaries, cornea, and others. So the idea of bioprinting involves getting a biopsy from the organ. Certain cells are isolated and multiplied. The cells are mixed with a special liquefied material in a special environment, and finally placed in the 3D printer, where the 3D printer can print bio organs. So you can collect the cells, place them in a suitable environment. You can send them to the 3D printer, can take the organ that you want to print using a CT or an MRI or whatever 3D modality, and the printer can shape this bioprinting according to the shape you want, and it prints them, the cells, using the bioprinter. So this photo in the middle, this picture, is for printing of a real kidney. Of course, still bioprinting is not very feasible nowadays. It needs at least, I think, about 10 years, more 10 years, but still it's in process, and it's very promising. It will definitely, we hope it's the future for curing diseases. And here is a simplified diagram for the 3D bioprinting. And here is a comparison about the materials used and accuracy and so on. The problem with 3D bioprinting is when you want to print organ with complex structures. You want to print arteries, veins, and muscles in the same print, and skin. This is very difficult. So this is the main challenge in 3D bioprinting. And of course, the sterilization in the environment is very critical. As you can see here, these are 3D printers used, taking the cells, okay, and printing them using the bioprinter. It's not just any printer, it's a specific printer, it's a bioprinter. Okay, as you can see here, this is a printed kidney. Okay. Can print ears, cartridges, and bone. Bone is much easier to print than any other structure because it's not very complex. Ovaries. So what are the possible applications of 3D bioprinting in dentistry? We can use the stem cells to print teeth. We can print bone. We can use teeth transplantation. Okay, so you can print your tooth in the future. You don't need to put an implant. You can put a 3D bioprinted tooth. Injection of pulp tissue for endodontic treatment. After doing endodontic treatment, after cleaning and shaping, you can inject pulp material using special techniques, of course, to regain vitality of teeth. And there are many researches about bioprinting. It's still in the process, but it's very promising. As you can see here, in periodontal surgeries, you can print connective tissue grafts, or you can print keratinized mucosa. This is very useful for implantologists. We are always deficient of keratinized mucosa, and this would solve the problem definitely if we can achieve this. 3D bioprinting of mandibles after resection of tumors. Of course, this will be a breakthrough. You can replace bone instead of making a second operation, taking graft from the iliac crest or the fibula. You can just 3D print your bone from stem cells. Let's have a look at this. Of course, we know this. You know this scene from the Terminator?
Hey, hey!
Get down.
So you see the wound healing of this guy in a science fiction movie. Can we achieve this type of wound healing? Of course not. If you're shot in the heart, you cannot heal. But maybe if you are injured in your skin, you can go to the hospital and you have your skin 3D bioprinted at the moment. Still, this is a fiction or science fiction for us, but hopefully it can be the future. If you have a bank for cells, or if you have your own bank, you can, if you're injured, you can 3D print your cells immediately and get out of the hospital healed. So it can be, some things are fiction and some things can be reality. So this is the idea. You just go to the hospital and you have your printer that can print different layers from cells to skin and so on, double. You can have a printing for the first layer of connective tissue, then another head of the 3D printer to print the second layer of epidermis. Okay, maybe it's not available now, but it can be available in the future.
Okay. Basically like a flatbed scanner. That's what you see here on the right side. you see a scanner technology that first scans the wound on the patient, and then it comes back with the print heads actually printing the layers that you require on the patients themselves. This is how it actually works. Here's a scanner going through, scanning the wound. Once it's scanned, sends information in layers, the correct layers of cells where they need to be. And now you're going to see here a demo of this actually being done in a representative wound.
This is amazing if you can achieve this, and we are not so far. We still can do it. So what are the advantages of 3D bioprinting? Many advantages. Of course, it covers the shortages of organ. If someone needs to donate a heart, you still have to wait until he passes away. But now you can 3D print your heart and do the surgery. Same for teeth and same for periodontal tissues and so on in our dental field. Testing on living tissue is a very important issue. We don't have to do experiments on animals or volunteers of human subjects. You just can print living cells and you can experiment on them as long as you like. And for example, like the COVID-19 we are facing today, we could have done this earlier about getting a vaccine. So it's very important, like this world pandemic. It could have been solved much earlier if we had this technology available now. Okay, it's less time consuming, it's more predictable, it's less expensive, saves animals from experiments. $50 billion are spent to produce 20 new drugs per year. Average drug costs 1.2 billion, takes 12 years to develop. With the 3D bioprinting, these numbers can be much more lesser to get the drug. So also printing sufficient amount of tissues, biocompatibility, and no morbidity of other donor sites or other patients. Challenges are a lot. Of course, printing without damaging the cells, it's a challenge. Precision of printing, how accurate and the type of cells being printed. Environmental control and strict sterile conditions and humidity. It's a very sensitive process and also a complex process and needs a lot of investment for research. So these are challenges facing 3D bioprinting. Then we have another type of printing, what we call the 4D printing, meaning that you can print smart materials. You can print a material that changes shape with time. So this is a 2D printed material on the left, in the middle is a 3D, and the 4D changes its shape with time based on a stimulus, such as temperature or humidity. How can we achieve this? Let's see the video. For example, this plastic sheet or whatever polymer, you place it in water and the cube starts unfolding and gives a new shape. Okay, this is what we call a 4D printing. It's based on time. Change in the 3D printed object based on time. As we can see here. So what if we can print smart materials, smart filling materials? What if we can print restorations that does not need undercuts, does not need bonding? It only depends on mechanical interlocking. Materials that will not creep. If the material creeps, it can self-correct itself. It has a memory. The material is smart. So definitely also, this is one of the objectives of getting into the smart era from the digital era, but of course needs a lot of calculations to achieve this process. The dimensions and so must be calculated first. It's unpredictable. So we won't need mechanical retention. In the preparations, we won't need any bonding or adhesives. We will not have creep or wear. The material is smart. It has a memory. It can correct itself automatically. As we can see here, We will not have these types of overhangs. The material again is smart. Okay. Another applications or expected applications for 4D printing, making restorations with elasticity properties to simulate the periodontal ligament for implants. Orthodontic aligners that can change itself by itself, can change shape, so do the desired movement. Doing TMJ surgery for disc replacement using change in size of the materials that we are putting in the meniscus area. Of course, challenges are a lot in 4D printing, maybe more than the 3D bioprinting. Time taken to change in dimensions, stopping changes after a certain time. How can you control the expansion in dimensions with the stimulus surrounding tissue behavior to such type of material, and also the pre-planning, the pre-operative planning. I need to control every issue and the size of the material before putting them in the patient's mouth. I need to know what will happen next. I need to predict it. Virtual reality, it's already used for education purpose. We call it stereo vision, and it began in 1962 in the movie or film making in the USA, most commonly and in video games. So the idea is you have a virtual reality box or a virtual glasses, and you have a haptic device, or you have a gloves or a sensor connected to your hand or whatever. It's very beneficial in education. You can take the sense of drilling, for example, implants, making surgery without doing surgery on an actual patient. So its main advantage is in education. Cavity preparations and so on with the haptic device. This is already available. It's not a big deal. Now it's available already in many prestigious and elite universities all around the world. As you can see, cavity preparation, surgeries, and so on. Useful in infection control. For example, if you use your glasses, you can see here. Okay, you can visualize your 3D CT or cone beam CT without having to look on the screen from 3 dimensions, without having an assistant to rotate the image for you. You can just use your non-sterile gloves virtually to rotate the image and see it from different directions during operating. Also holograms, as we can see, also for education purpose. You can see the holograms and virtual reality is very important in education. Okay, like this time, can holographic meetings be useful? Can we do a virtual, instead of Zoom meeting, can we make a holographic meeting? We don't know this yet. Could be. And you can do holographic surgeries while you're at home. You can practice doing the surgery online using a hologram. So you have your hologram patient, virtual patient, and you can start doing your surgery just for practicing. It's not for real. Also augmented reality, where you can see your X-rays on the real patient. We use this in digital smile design. We have already an application that does this. I think it's by Ivo Clark. It's an application you can download, and you can import your digital smile design and change different designs on the real patients. Also mixed reality in surgeries, as we can see here on the right. So augmented reality can be useful for case presentation to the patient and for 3D designing of restorations and taking the decisions. Okay. So this is the smart era we are talking about. It's not, some still is science fiction and some are not. As you can see here again, augmented reality for education and practicing. Okay. You can do your practice very easy and more efficient. 4D videography. Okay, you see this video. How was this video performed or shot? It involves taking the same shot using different cameras from different angles. And this is useful for emotional dentistry and analyzing your smile from different aspects and facial expressions. So 4D videography is superior, of course, to the regular videos. It gives you the same video from different angles. And it's already available nowadays, like 3DMD and other companies, they manufacture those 4D cameras. Connecting your patient's electronic health records using the new 5G smart applications. Also, 5G will change dentistry. You will have all your details easily in a virtual environment. Okay. You can use GPS devices in your restorations for location of your patient. For example, in the military, or if anything happens, you can just use a GPS in the restorations. Can we have a single modality that can scan all the structures, like just in one scan? For example, just a simple modality, a single modality that can get you enamel, dentine, cementum, the cheek, the facial expressions, all of this in one modality. Still, this is science fiction, but maybe, hopefully, in the smart era, we can get this type of machine. And this is a video
Artificial intelligence.
how the smart era would look like in the future.
Begin display of patient charts. Patient number 091882. Airway analysis. Next patient. Clinical decision support. Auto tooth segmentation. Root fracture detected. Extraction should be considered. Next patient. Orthodontic tracing analysis activated.
I want to use my artificial intelligence to help humans live a better life. I will
everyone. Hope you enjoyed the lecture. And this is really a shift from the digital era to the smart era. Thank you.